Hello, my name is Craig Poskus. This is chapter 19 of Bio 150, Infectious Diseases Affecting the Eyes and Skin. So let's get started. So the first skin infection is going to be the most common skin infection. Everybody knows what it is. Known what it is for 10, 15 years now. It's talked about in middle school. So it's going to be acne. Like I said before, it's the most common skin infection. The scientific name is Proprium bacterium acneum. I left out acneum. What it does is it infects hair follicles. After that, the inflammatory response will cause the pimples to swell up and be red. That'll cause the body to fill with neutrophils. That would cause the whitehead, and then you would pop it to relieve some pressure. But this is treated by topical antibiotics. So moving on to a more threatening type of disease is impetigo. This is caused by the Staphylococcus aureus and the Streptococcus pyogenes. These are highly contagious. It's most commonly found in younger children. The reason being is that they're always touching each other and all that. So how this will occur is that the S. aureus or the S. pyogenes will infect the skin. That'll then cause like scabbing to go over, and this is infectious by direct touch. So younger children, like in a daycare scene or something, is always touching each other, then touching themselves. This would cause the infection to spread. The good thing about it is that it only targets the epidermal layer, so it's not going to go any deeper. Adults usually don't get this just because the immune system has had a significant amount of time to develop. As far as younger children, they're early in their life, it hasn't developed yet. So in the last slide I mentioned the Staphylococcus aureus. I wanted to take a brief step aside from disease to kind of go a little bit deeper into what it is. The S. aureus resides mainly in the nasal area of about 60% of humans, so it is common to just have it, but it's not inactive until it reacts to something. So the S. aureus can affect any region of the body, and this is what makes it the most common pathogen. And the reason that it can affect any region of the body is because it has a wide variety of the virulences factors. There's 2 or 3 different types of tests that you can do. The most recommended one is the rapid test. It only takes roughly about 30 minutes to receive results, 30 minutes to an hour. And what that is, it's the latex bead augmentation test. So, like stating in the previous slide, S. aureus will be mentioned in most of these, and because it is the most common. The first example I have after following this aureus is the scalded skin syndrome. This is most commonly found in newborns. So this is due to during childbirth, the baby passes through the vaginal canal. That is when the S. aureus will then get onto the baby's skin, and then the lysogenic conversion sets in. That also brings in the exfoliative toxin, and the exfoliative toxin gets on the skin, and the reason the baby can't fight it off is because the immune system has not yet developed. So what this will end up doing is basically causing a massive blister all over the baby's body. This will cause the skin to slow off over time, And if left untreated, the secondary infections can be problematic. However, this is typically not life-threatening. So this disease is going to take a step away from S. aureus. It's gas gangrene. It is the Clostridium perfringens. And how it gets started is it's an anaerobic soil dwelling bacteria. So how this happens is if there's a portal of entry on the foot, like a cut or a blister or some type of open wound that is on your foot, you then will go outside and play in dirt and soil. Uh, that soil is enriched with the perfigen, the Clostridium perfringens, and once that sets up into your foot, um, it the wound needs to be properly cleaned. So if in the beginning, if you go outside playing in the soil, you get it in your foot and you don't properly clean it, then it's going to set up the infection. And once the infection is inside the body, poor blood flow, such as a diabetic problem, will enhance the spread. And the reason doing this is that it is an anaerobic soil, or anaerobic bacteria, so it does not like oxygen. Well, if you have a diabetic problem, the poor blood flow doesn't allow oxygen to get to the tissues. And once the infection is set up, it'll release exoenzymes that will destroy tissues. And what it will do, and the reason it's doing that is if it can destroy the tissues, then it's going to destroy the veins and the circulation and all that, which ultimately means that you won't have any more oxygen. Therefore, it can spread. It'll slowly creep up the extremities, such as your legs, and this is a very difficult treatment to stop. The only thing that you can do is amputate it. Okay, so I'm starting to run short on my 10-minute time limit for the PowerPoint. So just to do a complete jump, because this is skin and eye infectious diseases, I'm going to jump straight into the eyes. Just a little anatomy before I get into some of the diseases. On the surface of the eyes, the two exposed areas, I will say that it is the exposed areas of the eye, is going to be the cornea, and it covers the iris. It's a dome-shaped central portion of the eye. And then the next is the conjunctiva. That is like a thin membrane that, my apologies, a thin membrane-like tissue that covers the rest, such as the white part of the eye. Okay, so the most common disease that I want to get into involving the eye is conjunctivitis. And anyone that has taken medical terminology, you can pretty much figure this out. All it is just inflammation of the conjunctiva. So it's not very threatening. It's really not that big of a deal. Even in young children whose immune system's not fully developed yet. Basically, it's just inflammation that's going to cause your eyes to turn red or feel scratchy. The most common is pink eye. The only situation that this can be damaging to the host is if it was a newborn going through the birth canal, and in this situation, as the baby is being born, it can pass through the birth canal and through the vaginal area. It can pick up the chlamydia or tracheomitis and or gonorrhea, and this can cause scarring over the eyes or even blindness. But in the United States, first world country, most of this is tested for before having the kid. This is most commonly found in third world countries. So thank you for watching my PowerPoint. In terms of slide, this was my shortest one, but I went into more depth on the actual diseases. I just ran out of time. But if you have any questions or concerns, please let me know.